Hello and welcome to another episode of Illusion Training and Education. Asepsis and sterilization is of paramount importance in dental practice today. Especially when it comes to implant dentistry, it is extremely important to have a high level of sterilization to prevent bacterial contamination, to have good predictability and a high success rate. So let's go ahead and take a look at how the implant operatory needs to be set up just before the implant surgery. The first and the most important aspect is your autoclave. This here is a Class B autoclave with a drying cycle. My assistant here is loading the autoclave with all the instruments and the implant kit, hand pieces, etc. that I will need for my surgery. Once the cycle is complete, all the instruments will be removed very carefully. The implant operatory should be fumigated using formalin, after which the operatory will be closed with formalin fumes overnight before the day of the surgery. On the day of the surgery, it is time to set everything up. The saline bottles should be refrigerated before the surgery. All the footwear should ideally be outside the operatory, or at least these kind of shoe covers should be on. My assistant and I are now going to put on autoclave gloves in this manner. Notice that I am not touching the sterilization pouches which my assistant is opening. My assistant will now use a disinfectant spray like Surfacept for all the surfaces which cannot be sterilized. I shall now remove the sterile surgical disposables from the pack and lay down the tabletop cover where I shall keep my implant surgical kit and other instruments. I have these kits specially designed and customized for my liking, and these work beautifully. It is important to not touch any unsterile area with these autoclave gloves. I will also put down the tray cover to lay down all the surgical instruments. I will now start arranging my instruments one by one. It's now time to assemble the physio dispenser. I also have an autoclaved stainless steel bowl filled with betadine where I can keep my anesthetic cartridges and needles. I also have a rinsing cup for my patient which is filled with saline, and I also like putting these chlorhexidine tablets into it. It is now time to get my implant kit out and put it on the tabletop cover. I shall now drape my patient and disinfect the field of surgery using betadine. Notice how I am swabbing away from the oral cavity. I will now remove my gloves and scrub my hands in this manner. This is to reduce the bacterial load. The hands should be scrubbed for a minimum of 2.5 minutes per hand. I shall now put on the sterile surgical gown without touching its exterior. Finally, my assistant and I shall put on the surgical gloves and go ahead and start with the implant surgery. I hope this episode has been helpful to you. Please write in your comments and questions at the email address flashing on your screen. Also, let us know if you want us to feature a particular procedure in the upcoming episodes. This is Dr. Mahesh Jagwani signing off until next week. Keep watching.